Hello everyone, welcome to GS Booster Shot, your daily dose for GS preparations. In our today's lecture, we are going to talk about the Ayushman Bharat digital mission. So, Prime Minister of India has recently launched this very mission. Indian Express's today's explained section also covers up this very issue in detail. So, this issue happens to be important with respect to healthcare infrastructure in the country and the recent developments and improvements which are sought to take place in this very sector. Let us understand about Ayushman Bharat digital mission by means of a question. So, the question would be, explain Ayushman Bharat digital mission, its features along with intended benefits and associated challenges. This would roughly cover up all the aspects of this very mission. So, first of all, let us also see the implementing authority behind Ayushman Bharat digital mission. This is generally important with respect to prelims. So, Ayushman Bharat digital mission will be implemented by National Health Authority. This National Health Authority works under the Ministry of Health and Family Welfare. National Health Authority is also responsible for implementing Ayushman Bharat, which is an umbrella insurance scheme of the Government of India, health insurance scheme. So let us see where this idea of a digital platform for sharing health related information came from. So, the National Health Policy of 2017 had actually envisaged creation of a digital health technology ecosystem. The aim was to integrate health information system that serves the needs of all the stakeholders. Who would be all the stakeholders? Not just patients. These stakeholders would also include nurses, health service providers, hospitals, pharmacies, insurance companies. So, this would improve the efficiency, transparency and citizens' experience with linkages across public and private healthcare. When we say linkages across public and private healthcare, it means that not only the government sector health related entities such as the hospitals would be part of this, however, even private sector entities would also be part of this. So therefore, Ayushman Bharat digital mission is a step towards this very direction of creating an ecosystem, a digital health ecosystem. Now, some of the key features which are launched along with this very platform as of now are the Health ID, Personal Health Records, DigiDoctor and Health Facility Registry. Now let us see what all these are. First of all, let us start with Health ID. So, Ayushman Bharat digital mission, it is basically a platform to share all the information with respect to an individual's health or information with respect to hospitals and between all the stakeholders which are present in this healthcare system. So, an individual is first required to create a health ID on this very platform. This platform has an app as well as a website. So, individual can go either on the app or a website and create his health ID. And a health ID can be created by simply using one's Aadhaar number or one's mobile phone number. Later on, the government has said that they will also be including license and other proofs such as PAN card in order to create this very health ID. Now, it is not mandatory for any individual to be part of this very ecosystem. This has to be kept in mind. So, every patient who wishes to have their health records available digitally must first create this health ID. Thereafter, this health ID will be linked to a personal health record address. What is a personal health record address? Basically, National Health Authority has said that this authority is not going to keep records of an individual's health. These records are going to be kept by Health Information Exchange and Consent Manager. This Health Information Exchange and Consent Manager is known as an individual's personal health record address. So with time, number of companies can set up this health information exchanges. You can link this or relate this with the UPI payment system. So UPI is a platform, and every bank has their own very platform through which the exchange of money can be facilitated digitally by means of this very platform created by the government, that is the Uniform Payment Interface. In this very manner only, the health information exchange is going to use the platform of Ayushman Bharat digital mission for exchange of an individual's health history between different stakeholders. For further clarity, let us see how this is going to work. So health information exchange and consent manager. Why it has been referred to as a consent manager? So naturally an individual might not allow or might not want that his information should be shared with every person out there. So these health information exchanges will be having their specific consent policy. If that specific consent policy suits an individual, that very individual can be choose that very health information exchange as his personal health records address. So this would vary from different health information exchanges to exchanges. So this health information exchanges can be used by doctors, nurses, pharmacists and other healthcare providers so as to access securely a patient's vital medical information electronically. This would improve the speed, quality, safety and cost of patient care. So what will happen is that a patient can give the authority to this very health exchange so to store his data as well. So patient can directly ask his hospital to upload his vital documents, health related documents on this very portal. Patient can allow his insurance company so as to, if the insurance company wants to seek health records for the purpose of any verification or something, the insurance company can seek these very records by this health information exchange with naturally the consent of the, if the consent has been provided to health information exchange by the individual. An individual can at any point in time withdraw his consent. He can also delete his ID at any point in time. He would also be having the option to deactivate this very ID like we have on Facebook. We can either delete our Facebook ID or we can keep it deactivated and activate it at any point in future. Now, besides this health information exchange is also responsible for managing the consent of the with respect to sharing of these very information, and it will be held accountable if there is any discrepancy with respect to the same. Now let us see what are the benefits, specific benefits. Number one, it would increase the ease of living along with simplifying procedures in hospitals. Today, checking in a hospital and checking out from a hospital is a very big task. Despite of everything being done, there would be a lot of formalities that would keep individuals waiting for long hours in hospital lobbies in order to just check in into a hospital. Sometimes the hospitals are checking and or verifying an individual's health records, health history, whether his history or something is being covered by an insurance plan or not. While discharging an individual, there is a huge task of giving the entire record to the individual, and while waiting for that very record to come, an individual generally spends numerous hours in hospital lobbies. So by coming of Ayushman Bharat digital mission, now hospitals could directly access an individual's verified data from the health information exchange and also can upload this his discharge summary and certain things upon his very ID itself only. So this would save vital time. It would make convenient the transfer procedure of patients from one hospital to another. So supposedly an individuals, what is happening right now, that individual hospital chains, they do have an health ID which keeps the record of a patient. However, there is no such procedure in which this very information can be directly transferred to another hospital's network. This very Ayushman Bharat digital mission will facilitate this transfer of information and is going to provide a digital platform through which this very information can be transferred and accessed by a different hospital. And this would solve troubles of very patients who are generally referred from one hospital to other, or who are shifting from one town to other and needs to change their very hospital and healthcare provider. Besides this, it would relieve individuals from the task of maintaining long-term health histories, which may be useful at a later stage. So, right from the birth of an individual till his puberty and adulthood and death, or reaching old age, an individual visits a hospital a number of times with minor or major problems. He undergoes minor surgeries or minor fractures or a major fracture. All of these things today can result into any sort of a complication at later hand. It is virtually difficult and impossible for an individual to maintain a health history of such a long period of time. And therefore, this very digital mission, this very platform would provide as a safe option for an individual so as to store his entire history on this very platform. Then, it would help insurance companies if information is shared with them for processing of claims and verification of patient health status. Also, it may help prevent insurance frauds. So generally, there is a lot of insurance fraud in the country when it comes to death claims. An individual might not record his actual health data history with insurance companies. In this very scenario, this very health database can come in handy. For this, we have to wait and see as to what sort of consent policies would come up, whether insurance companies would be able to get free access to this very health information or not. So, in this very scenario, insurance companies can also create certain rules and regulations and may charge different premium for different individuals having health ID or not at a future date. So, by retrieving, it will be possible for health insurance companies so as to seek information from these health information exchanges with respect to a patient's health related history so as to process their claims or decide their premiums. Naturally, this would depend on the consent as well. The Ayushman Bharat mission, digital mission, would also provide information with respect to certified doctors around one's location along with labs and drug stores. So, not just individuals would be making a health ID over it, even doctors and specialists can also make ID over this very thing along with pharmacies. So, this would help an individual in any area wheresoever he is residing so as to locate by the help of this very database any doctors he would like in nearby his areas. This would solve one another problem also. Many a times an individual falls into the traps of quacks. There is a large problem of quacks or doctors or people who are practicing as doctors, disguised as doctors in this very country. So, upon this very platform, it would be only certified doctors who can actually register themselves. So, this would help and this would provide us with a repository of doctors nearby along with pharmacies and laboratories for testing purposes. Now, no scheme or no program is without its unique challenges. Let us see the challenges which are faced by Ayushman Bharat digital mission. First of all, this very mission still does not recognize health as a justiciable right. So, in this developing world and with increasing social net and demand of social net, now since a long time there has been a demand of making health as a justiciable right, of putting the responsibility of providing health care to individuals as upon the government's shoulder. The draft National Health policy of 2015 had actually prescribed to making health as a justiciable right. However, yet it has not been done. So, another thing with respect to this very mission is the concerns with respect to data security and privacy of patients. So, as we have seen lately, that many digital companies and especially social media companies have been sharing personal data of individuals for various other purposes. It has to be seen that data security is maintained, and whosoever breaches this data security with respect to a patient's information, the person or the health information exchange needs to be prosecuted with respect to the same. And we have to see how tight rules would be in future. One thing why this is important with respect to India. So India is a society which is still believes in number of stereotypes. So just imagine if an individual is taking some mental health care from a professional psychiatrist, and if this very information leaks out into the public, there is still taboo in a lot of societies with respect to the same. Along with this, there are various diseases that an individual may suffer from and not want the society to know about it because of the prevailing taboos in the society with respect to those diseases. So there should be no instance in which this very security net could be breached and individuals' personal information would come in public domain. Then it has to be seen that we should learn from the failure of National Health Service of United Kingdom. So basically this very digital mission is somewhat modeled on United Kingdom's National Health Services. The United Nations National Health Services has been going on in crisis for quite some time now. It has to be seen that in order to just update the records, the National Health Service of United Kingdom had spent billions and still they were not able to do those things properly. Therefore, we need to learn from their mistakes, and it has to be seen that these mistakes in this digitization process of health related information should not occur with respect to India. Therefore, there should be sufficient trial runs have been taken so as to implement this very program without any hitch. Then with respect to standardization of Ayushman Bharat digital missions architecture across the country, it is going to need ways to accommodate state specific rules. As we know that health is also a subject that comes under the domain of state governments, and therefore in order to bring state governments on board of this very mission, and only this mission will become true success when all the state governments' resources are also listed on this very platform, and therefore it has to accommodate the concerns, rules and regulations of state governments also. Besides this, there are a number of schemes of the government such as the Ayushman Bharat Yojana, the IT enabled schemes like reproductive child health care, the Nikshay with respect to TB eradication in the country. So it has to be seen that these very schemes are all, and the beneficiaries of these very schemes are also incorporated in this very platform so as to for the ease of implementation of these schemes as well. So this would be all with respect to Ayushman Bharat's digital mission. I would be attaching the PDF of this very lecture along with the lecture. Should you have any doubts, feel free to put your doubts in the comment section. I'd be more than happy to reply to them. Thank you and have a nice day.